Okay, so going back. So we are in the number 9, in the implants or patches. So types of medication includes, implants or patches. So these implants or patches, these medicines are absorbed through the skin. So such as nicotine patches for help in giving up smoking. So you heard about the patches? They are used for like medicines, but in a form of patches. So like for us, it is here in the Philippines or right now here in the UAE, we have available of this salon pass. So it is used for those aching backs, aching joints, for the pain of the back, pain of the joints. So they are just putting it, patching it, okay, to relieve the pain. So we have also like the implants. Implants are like breast implants. They are silicones. They are being put inside of a human body. Like for example, the pacemaker for the heart. So we have the nails, the screws for the to be fixed inside of the bones. What else do we have? We have for the implants. We have the eye, those prostheses, they are implanting it inside of our bodies. So contraceptive implants for those women. So they are putting something there to be implanted inside or under the skin or in the body to help us, to help in, to healing, to help in prevention. Okay, so those are implants or patches. So we have the buccal or sublingual tablets or liquids. You can see on the right side. So they are tablets, but you don't swallow it. So it will stay only in buccal is on the side of the cheek, inside of the lining of the cheek. And the sublingual, it is under the tongue. Okay? So these medications are not going to be swallowed. So they will stay where they are. They are going to be absorbed in that area only because the effectiveness of those medication is through the absorption under the tongue and on that side of the cheek. Buccal is on the side of the cheek. They are held in the cheek, or so the mouth lining absorbs the active ingredients. So with the sublingual, it is underneath the tongue. So buccal and sublingual medicines, they only be given in a very specific condition. Some of those medicines or tablets for those heart attack patients, so they are using it for the sublingual because it is easy to be absorbed. So here under the tongue, it is very thin layer of the skin. And the effectiveness of these medicines are very effective once it is put underneath the tongue or on the side of the cheek. That's why they are called buccal or sublingual. Okay, so we have 10 types of medicines. So again, what are those 10 types of the medicine?
Liquid, tablet,
Okay,
capsules, drops,
okay.
inhalers,
Mm,
topical medicine,
mm,
suppositories, injection, implant or patches, vocal or
mm,
sublingual tablet.
okay. More?
Injection.
And then, two more?
I think the inhaler already finished.
Yes. Inhaler, did you mention inhaler?
Yep. Liquid,
Yeah.
tablet, capsule, drops, inhaler, vocal or
Mm,
sublingual tablet, implants or patches,
mm,
injection,
mm,
suppositories, and topical
mm.
medicine.
Okay, so they are 10. So they are the types of medicines which we are going, one or the other, we are going to administer to our patients. So in the management of the importance of the proper medication management, the probability of issues arising when patients are left to administer their own medication is very high. And medication errors are especially common for the elderly who may take 5 or more prescribed medication each day. Could you imagine that? Your patient, those patients who are elderly, who are already old enough, so they have the mixture, a mixture of different illnesses. So they have the disease for the kidney, they have the diabetes, they have something for the heart, they have something for like this, for like that. So as the medication also are tripled or 5 or more of those. So now, if the patients themselves will be taking the medications, so we are not sure that the patients will be able to take it without missing 1 or 2 per day. So they are hiring caregivers, they are hiring nursing aides, they are hiring even licensed nurses, especially for those paying the private nurses. Okay? So our responsibility now is to ensure that this medication is being given and to reduce the harm to the patient, but because that is due to this medication error. We don't know whether this medication that they are going to take will be doubled or they are going to miss one of those. So often, the prescribed by different doctors that lead patients to deviating from their prescribed regimen. So let's say the patient goes to another doctor and he will go to another doctor. So he is collecting more or how many more of these medicines. So per day, how many medicines she or he will be able to take per day. However, with professional nursing aid assistance, so here you go, you will be hired because of this. So with the professional nursing aid assistance, the rate of errors in medication administration is reduced. Why reduced? Because they are hired you and it's your responsibility to see to it that all of these medications will be given on time. So due to confusion, when your patient is already old enough, due to confusion, communication issues, or misunderstanding instructions, with caregivers or the nursing aid errors were reduced with their medication because there is a consistent guidance from a professional nursing aide and patients maintain their prescription medication regimen. Okay, so the medication error will be reduced because now it is in your hands. So you will be the one to administer medication for them to the right patient, at the right time for the right medications. So in management of the patient, we have the roles and responsibilities of the nursing aide. So what are the roles and responsibilities of the nursing aide? Number one, ensuring correct medications are taken as prescribed. So it should be correct medication that is going to be taken by the patient. Secondly, we have to monitor patient and oversee the medication is prescribed. We have to monitor. Maybe we don't know what the patient is already doing. So once you give to the patient, don't leave the patient until you are sure that it is taken. Okay? You don't leave it to the bedside. So the patient might forget the time to take. Or who knows? The patient has taken it in front of you, but once you are gone, those medicine is being taken out from the mouth and thrown it. Who knows? Okay? So you have to monitor what patient is doing and oversee the medication as prescribed, ensuring correct medicine is taken by the right patient at the right time. So with the right patient, if you are in the hospital, it is going to be like there might be a incorrect patient medication, different medication to different patient given in a different time. So who knows? Somebody was just asking, please give it to room 5. And this medication, the one who prepared did not give it to the same patient. So there is going to be a medication error. So number four is to perform medication reconciliation whenever there is a prescribed change to the type of dosage of medication. For example, the patient is taking now 5 tablets. So tomorrow you will be going with the patient to the hospital. And from home, you have 5 tablets. Once you reach in the hospital, the doctor removed the other 2. He replaced the other 2 with another 3. So there are new, there is this discontinued or removed. So this is the medication reconciliation. So from home, transferring to the hospital, from the hospital coming back to the home, there is a so-called medication reconciliation. The transfer of one of places from home to the hospital, hospital back to home with different prescription or orders from the doctor. Number 5, to check for any signs of adverse issues. Like for example, you have given the medication today. So the patient, you have observed that the patient is sleepy and the patient is vomiting or the patient is nauseated. So there are signs of these bad issues, poor issues. So sometimes there are some skin rashes that will come out. There are some allergic reaction resulting from the changes in medication. So you must be observant. You are the one together with the patient. So you know the patient more than anybody else from that home. So verifying that no medication are being omitted. Okay? There must not be there must no medication going to be omitted or not given. You don't miss anything. And that the correct dosage is administered by matching up the number of tablets or pills taken with the number in the original prescription. Like for example, you have to give 10 medicine, 10 tablets. Out of the 10, there are tablets, there are capsules, there are, what else is there? So with that 10, so you are now checking how many of these are in that list the doctor has given you. So you have to compare. Is that 10 on the list? Is that 10 names are on the list? So you have to compare, you have to verify. So you won't be confused whether you have given the 5 it is written or the 10 which is written in the list of orders. Monitor any other substances that are being taken, such as vitamins, supplements, or foods that may affect the effectiveness of the prescribed medicine. Like for example, your patients, aside from the 5 medications or 10 medication, there are still like these tablets that is going to be diluted in water, those vitamins that is not prescribed by the doctor, but the family wanted the patient to take these vitamins. So this is out of the list of the doctors, but they are supplements. So you have to monitor that also are taken by the patient. Now, for the effective management of medication, of patient's medication, there are basics. Basic management, they are called basics of effective medication management. We have three. Those basics to make it effective medication management, which is very important, we have to follow these three basics of effective medication management. Number one, we have to make a list and document current medications. So you have to make a list. In our practical, I will ask you to do this list. We will make a document, so we will see how you will know if you are already in your present in the actual work. In that list of the document, we will list the current medication, those medications that are currently being taken by the patients. So like, for example, we will write there medication name, the drug of the name of the drug. Like, for example, Panadol. You have to write there, Panadol, then how much is the Panadol dosage? 1 tablet. Then how often? What is the frequency? Twice daily, 8 morning and 8 p.m. Then when it started to be given, it started on 4/26. Then does it need to be refrigerated? Does it need a cooling? I mean, this medicine needs how many percent of, how many degrees of coldness does it need? So does it need to be free in freezer, or does it need only in the room temperature outside, or does it need to be refrigerated with the -4 degrees centigrade? So yes or no. So physician who prescribed this medication, you also have to write the notes. Take medication like, for example, the insulin. Insulin as prescribed by the doctor to be taken once a day before bedtime, before sleeping. So there is a note there. Okay? So we have to follow what is in here, and we have to actually do it. So we will do it. So we will know when we come to this situation that we are going to give medication, you are already prepared on what to do. Number one, the basic of effective medication management is to make a list and document current medication. Number two, we have to create a medication dispensing system. Dispensing system, the use of the most common pill organizer with multiple compartments for the days of the week. Fill it weekly. Okay, for the week, what did I say in the first? You have to see the photograph on the first. So this is the dispenser, the medication dispenser. Okay? This medication dispenser, we are going to use it, fill it in a week's time. If you know that the medicine of the patient is within 1 week, so better fill it up. Monday, Tuesday, Wednesday, Thursday, Friday, if the medication are going to be the same for the whole week. Okay? So you won't miss anything. So it will be there. But giving to the patient, you have to check again whether this is the same medicine that you have put in. Correct? Right? Okay. So number three, we have for the basic is keeping medication list updated. So keeping medication list updated, so it is critical to keep your patient's medication list updated. Like, for example, as I said, you have gone to the hospital for the physical checkup of your patient. So there, the doctor has removed 2 of the old medication, and he added another 3 new. So when you come back home, you keep your list updated. In that same list, you have to check whether what medications it has taken off, what medication has stopped, what medication is new. So all of this, you have to update your medication list. So delete medicines that are discontinued or no longer prescribed or needed. Add new ones. Okay? So we have three basic effective medication management. So we know how to manage our medications. So what are the purpose? Why we do this medication management? Why we do this? So purposely, number one, to help prevent many medication errors. Okay, so the first and foremost is to prevent the medication error. Medication error, maybe you have given two, maybe all the expired medicine is given, maybe the discontinued medicine is still given. So help prevent many medication errors. So number two, to help guide licensed nurses to administer medication safely. So nurses who are primarily involved in the administration of medication benefited from this simplified memory aid. So to ensure safe and quality patient care at all times. So as many nursing tasks involved in the degree of risk, medication administration arguably carries the greatest risk. So there is a greatest risk in medication, in giving of medication. So we have to remember that the first and foremost, we need to prevent patients from any medication errors. Going to 10 rights of drug administration. What are the 10 rights of drug administration? Number one, we have the right patient. So check the name on the order of the patient's file. So check whether the name is, your patient name is in the prescription or it is in the order. So use two identifiers. What are those international? This is as per the standard. Two identifiers in identifying patient. Number one is the patient name and number two is the patient's medical records number. So did you see when you go to the hospital or have you ever been to the hospital and you find the patients, they have the ID, they have the bracelet. So in that bracelet, if you can check it, you will find there is a name of the patient and there is the medical records number or the hospital number. Okay, so these are the two identifiers. It is international standard based on the reference of Joint Commission International of USA. So again, what you will do with the patient, you don't ask the patient name. When you are with the patient, you don't ask their name. If you will ask them, they will tell you, I'm Juan. You are Juan, sir? And then your patient will answer, yes, I am. And next to that, that patient is not Juan's name. He just repeated what you have asked him. Okay? So don't ask the patient name. Ask the patient to identify himself or herself. So what you will ask is, just ask the patient, can you tell me, sir, what is your name? So definitely your patient is going to tell his or her name. You don't ask. When available, use technology. For example, in the big hospitals, we already have the barcode system. So barcode system, you know what is barcode? If you go to the supermarket or in the mall, all these items that you will buy, they have a barcode. So they have a gun, something like barcode gun. They will just direct it to that barcode and automatically that number will appear and that number is a number of your patient, carrying the number of your patient. So it is easy for us. There is no need for us to write at anywhere. So it will be a barcode system. Number two is a right drug or a right medication. So right drug or right medication, we have to check the medication label. For example, this is Panadol. Don't just give Panadol. Read it. Okay? Check the medication label from the box where did you get the medicine and compare it to the tablet that you have taken. It is the same as Panadol tablet, Panadol 500, Panadol 500. So this is how you are going to check the label. Check the doctor's order. So with the doctor's order, you will be able to check all the details. The drug that is ordered by the doctor, how much is the dosage, everything will be there in the drug prescription or drug order. So check the expiry and validity of that medicine. So when checking the right drug, you have to check the the expiry of that drug. So you check whether that expiry is already 1 month ago or 3 months ago. So dispose it. You don't ever give it to the patient. So we have the right patient with the right drug, with a right dose. So now with the right dose, we have to check again the order. So check again the order for how much you will be giving. Like the order said, Panadol 500, 1 tablet to give now. So that is the order. So the order, you check the order and bring it to the patient. Confirm the appropriateness of the dose using a current drug reference. Okay? So that label, you have taken it, like what I said, you have taken it in the box of Panadol. So in that box, you check that this is the expiry date of this is like this and like that. Okay? So you have to compare with the label. Number 3, if necessary, you have to calculate the dose and have another nurse calculate the dose as well. So for example, this one is in dropper. You are going to give the patient baby. You are going to give vitamin by the dropper. So it is mentioned there 1 ml. So there is the 1 ml. You have to check it if there is any nurse with you. You have to check with the nurse and calculate if it is 1 ml. So right route. Now we have with the right route. Okay? Route means where is going to be. Like by the mouth, it is oral. By the rectal, it is rectum, suppository. Injection, either it is to the sub-Q or intramuscular, or the topical. Topical is on the skin. So you must have the right route. So again, check the order and appropriateness of the route ordered. So like the Panadol, Panadol 500 milligram, 1 tablet by mouth. It is not mentioned there, suppository. So by the way, Panadol has suppository. For the babies, we are giving Panadol suppository for children. Okay? So confirm that the patient can take or receive the medication by the order route. Okay? So right patient with the right dose, so at the right time, with the right drug, with the right dose, at the right route. Number 5, at the right time. So all these right, there are 10 rights. At the right time, check the frequency of the ordered medication. For example, Panadol 500, 1 tablet, the frequency time is twice a day. So you have to give it on the time, like in the morning, if it is twice a day, it should be 12 hours difference. 12, it should be 8 in the morning and 8 in the night. So if it is four times a day, you should divide the 24 hours into 4 times. Like for example, so 8, 8 and 8 and 8 and 8. So you have 24 hours divided by 8 into 4. Okay, so this is how you are going to put the frequency on time. Check the frequency, double check that you are giving the ordered dose at the correct time. Okay, so confirm when was the last dose given. So when you are two who are going to take care of your patient. So in your handover, you will make a note. So the last dose of Panadol was given 8 o'clock in the morning. So the next dose will be given at 8 o'clock in the night. So you know that it is 8 and 8. So twice a day, every 8 hours. Write documentation. So document administration of the drug after giving the ordered medication. If you have given already the Panadol at 8 o'clock in the morning, so you have to record 8 o'clock a.m. Panadol 500 milligram given, and the date and signature, Julius. You are the one who gave, your name and your signature should be there. Okay? So that is the right documentation. Document also the route. Panadol 500 milligram given by oral, by mouth. So you have to carefully specify which route did you give the Panadol. Document the site of the injection. If, for example, you have given the injection, insulin injection, at night, at 8 o'clock in the night, so you have to document 30 units of insulin given at the right leg at 8 p.m. on January 2. So this is how you are going to document your medication. Document any laboratory value or vital sign that needed to be checked before giving the drug. There are medications, especially of the elderly, of the old ones. Like for example, if they have a problem with the heart, so they are going to take some medication like aspirin. So doctors order vital sign to be taken like heart rate. Take the heart rate before giving the aspirin. So you have to record that heart rate 50, Panadol given or aspirin given. This is how you are going to document it. So document any laboratory value. So like for example, the lab called you. So the hemoglobin of the patient is 7. Give the lab called you that hemoglobin is 7. You inform your nurse or your doctor at home. And the doctor said, give if the laboratory is 7. Give 1 tablet of iron tablet. So the same thing, hemoglobin 7, drug iron sulfate given 1 tablet 7 o'clock. This is how you are going to document. Okay? So this is the right documentation. 7, right drug approach and right to refuse. Patient, once you explained everything to the patient, the consequences, the side effects of the medicine, then finally, the patient will refuse to take the medication. So when the patient refuses to take the medication, it is your responsibility to get the signature of the patient. Refused. Then let the patient or the family member to sign. 8 p.m. Medicine Panadol due, refused by patient. So you are safe. Patient refused, so he signed. So with the time, So because it is his right to refuse also, but as long as it is documented. Number 8, right drug interaction and evaluation. Like for example, the medicine that you are going to give has an interaction. Like for example, this medicine for the heart, if you give it, something will happen to the liver, something will happen to the kidney. So there is a drug interaction. So now, review the medication previously given or the diet which caused the interaction and inform the doctor that the patient has an interaction with blah 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 with such drug, and doctor, can we be able not to give it now since the patient is having this interaction? So you have to know because you are with the patient. So check also the expiry date of the medication being given. As I said, you better not to give any expired medication. Be safe. Okay? Write it down. Drug interaction, blah, 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 this X medication. So inform the doctor, not given. So this is how we are going to follow the right drug interaction and evaluation, and properly document it. Number 9 is the right history, right assessment. So you have to know, you have to obtain a copy. Or if not, you have to know it from the doctor that the patient have allergy for seafoods. So the patient could not take any seafood. So in your assessment, write it down with your documentation in a record book, in a red pencil, in a red pen, drug as a drug allergy or food allergy, shrimp, seafoods. So drug allergy, Panadol. So you have to write it down. You have to document everything. Number 10, write education or write instruction. In all procedures, especially in giving medication, before giving to the patient, you have to instruct, educate patient. Nowadays, by the way, because of this Google, so patients are knowing better than us. Before they come to the center, before they come to the hospital, they know already what they wanted to ask from the doctor. So when the doctor tells the patient that this is like this, I know it already, doctor. I Googled it before I came to you. You see? So you cannot fool the patients now. They have the Google. Mr. Google is always helping them. So better in your education, in your instruction, you must know that you are right in saying the right thing. Okay? You just don't say this. You have to have a proof. So when the patient asks you, where did you get that proof? Where is your